Hello everyone, welcome back to Dr.shil's Physio Victory. In today's video, we are going to discuss last 40 extremely important MCQs of electrotherapy which are repeatedly asked in different competitive exams for MPT or government physiotherapy jobs. I will not just tell you the answers, but I will explain why that option is correct so that you never forget it. Let's begin. Today's first question is, which is a better electrotherapy modality for stress incontinence? Option A, TENS. Option B, Faraday stimulation. Option C, IFT. Or option D, interrupted direct current. So the correct answer is option B, Faraday stimulation. Faraday stimulation is a form of low frequency interrupted direct current. Frequency is from 50 to 100 Hz, is particularly effective for stress urinary incontinence because it targets pelvic floor muscle re-education and strengthening, whereas TENS is used for pain relief, and IFT is also a better modality for pain relief and edema control. And interrupted direct current is less specific for pelvic floor muscles. Come to next question. If the intensity remains constant, at what frequency of current the muscle contraction may decrease? Option A, less than 100 Hz. Option B, 100 Hz. Option C, 1000 Hz. Option D, less than 1000 Hz. Here the correct answer is 100 Hz because at constant current intensity, muscle contraction force initially uh, increase from 40 to 60 hertz. Specifically, it is optimum in 50 hertz, but after 60 hertz, it generally reduces. Beyond 100, it is basically start reduced. Come to next question. The Rio base is option A, unchanged in denervated muscle. Option B, increases in denervated muscle. Option C, decreased in a denervated muscle. Option D, first increase then decrease. Here the correct answer is decrease decreases in denervated muscle. In physiology, Riobase is the Riobase is the minimum current strength which is required to stimulate a muscle or nerve. When a muscle is denervated, it becomes more sensitive to chemical stimuli like acetylcholine and also to direct electrical stimulation. This phenomena is known as denervated hypersensitivity. This is called denervated or denervation hypersensitivity. Next, come to question number 4. Which one among the following is true for voluntary and electrical stimulation? Option A, voluntary contraction stimulates type 1 but electrical stimulation electrical stimulation stimulates type 2 fiber. Option B, voluntary stimulates type 2 but electrical stimulation stimulates type 1. Option C, there is gradual recruitment in electrical stimulation. Option D, there is synchronized response in voluntary contraction. Here, the correct answer is very easy. Option A, voluntary contraction stimulates type 1 and electrical stimulation stimulates type 2. Next, come to question number 5. Benefit of Russian current over Faradic stimulation is option A, better pain relieving effect. Option B, covers larger stimulation area. Option C, stimulation of deep muscles. Option D, better facilitation of facilitator of healing. Here the correct answer is stimulation of deep muscles. Russian current is a medium frequency current which penetrates up to 5 to 10 centimeter. Next, come to question number 6. In unilateral nerve injury, when required current intensity is 10 to 20 times of opposite side. Option A, neuropraxia. Option B, axonotemesis of few nerve fibers. Option C, axonotemesis of almost all nerve fibers. And option D, neurotemesis. Here, the correct answer is axonotemesis of almost all nerve fibers. Neuropraxia is just a conduction block or uh, in this case the axon is intact. Neuropraxia. In axonotemesis uh, there is a affection of or denervation of some fibers, mild increase in current requirement. When there is axonotemesis of almost all nerve fibers, there is increase of 10 to 100 times more current. Next, come to question number 7. What is the optimal frequency for muscle contraction? It is a very controversial question, but option A, 10 to 20 Hz, option B, 20 to 30 Hz, option C, 30 to 40 Hz, option D, 40 to 60 Hz. Actually, the optimum frequency is 50 Hz according to the all books. Uh, Here, the correct answer is option D. Next, come to question number 8. In ionophorosis, total number of ions introduced proportional to option A, current. Option B, current density. Option C, time of application. Option D, both B and C. Here the correct answer is both B and C. Option D is the correct answer. According to the Faraday's law, total ion delivered is equals to current density into time into transport number into area by Faraday constant. Next, come to question number 9. EMG reveals action potential of option A muscle, option B motor unit, option C nerve fiber, option D none of the above. It's very easy question. That is motor unit. Normal is 0.5 to 2 millisecond and amplitude of 100 to 500 microvolt amplitude. Come to next question. What might be the strength of current required to stimulate a muscle with pulse of 10 millisecond duration? Option A same as required for 30 millisecond pulse. Option B same as required for 1 millisecond pulse. Option C twice as 30 millisecond pulse. Option D half of 1 millisecond pulse. According to the strength duration curve, after 1 millisecond there is no change. So after 10 millisecond there is no change. So the correct answer is 30 millisecond. uh, Basically beyond the 5 to 10 millisecond actually there is no change, curve becomes into plateau. Next, come to question number 11. Chemical burn due to direct current is likely at option A cathode, option B anode, option C both electrode, option D where acids are formed. Here the correct answer is option A cathode or negatively charged electrode. Direct current or electrolysis at cathode produces hydroxide ion. Basically produces hydroxide ion, creating an alkaline environment that can cause chemical burn due to tissue irritation and liquefaction of necrosis. Next, come to question number 12. Rhythmic 1 to 100 Hz interferential current may be helpful for option A muscle contraction, option B pain relief, option C reduction of edema, option D none of the above. Here the correct answer is pain relief. For edema reduction we generally use 1 to 10 Hz rhythmic, and for muscle contraction 50 to 100 Hz. We generally not use IFT for muscle contraction. Next question, utilization time. Option A same as chronaxy, option B pulse duration at Rio-base current, option C shortest duration of pulse at Rio-base current, option D longest duration of pulse at Rio-base current. Here the correct answer is shortest duration of pulse at Rio-base current. Utilization time is the minimal pulse duration required for a Rio-base strength current to depolarize the nerve or muscle membrane and elicit a response. It makes the curves inflection where shorter pulse fails to excite. Next, come to question number 14. Factors important for penetration of iron are: option A, conductivity; option B, pH; option C, uh, precipitation; option D, all of the above. Here, the correct answer is all of the above. Uh, in anatophoresis, mm, actually a common it is a common electrotherapy technique in physiotherapy for transdermal delivery of iron or ionized drugs. The penetration and transfer of ion depends on several key features like conductivity, pH, and precipitation. Conductivity is the solution must have sufficient electrical conductivity for efficient current flow and ion transport. pH controls the degree of ionization of the drugs, and precipitation refers to avoiding or managing insoluble precipitation in the drugs. Next, come to question number 15. For a pulse duration of 1 millisecond, what can be the maximum frequency for nerve depolarization? Option A, 100 Hz; option B, 500 Hz; option C, 1000 Hz; option D, none of the above. It is a clear mathematics. 1 millisecond is equals to 0.001 second, and frequency is 1 by t. So 1 by 0.001 is equals to 1000 hertz. Here the correct answer is C. Next, come to question number 16. SD curve can, option A, distinguish between innervated and denervated; option B, distinguish but cannot quantify; option C, distinguish and quantify state of innervation; option D, none of the above. Here the correct answer is option C, distinguish and quantify state of innervation. Next, come to question number 17. First twitch muscle fibers can be stimulated at a frequency of. This is a flat question. Option A, 10 to 20 Hz; option B, 30 to 40 Hz; option C, 50 to 150 Hz; option D, 200 Hz. There is correct answer is 50 to 150 Hz. Fast twitching is basically type 2 muscle fiber. Next, come to question number 18. Chronaxy for denervated muscle is: option A, less than 1 millisecond; option B, less than 10 millisecond; option C, more than 10 millisecond; option D, more than 1 millisecond. Here the correct answer is option C, more than 10 millisecond. Chronaxy is the maximum pulse duration required to elicit a tissue using a current strength twice the DO base. For non-elevated muscle or skeletal muscle, chronaxy is typically less than 1 millisecond, often 0.1 to 0.5 millisecond, and in denervated muscle, normal muscle, for uh, denervated muscle, it is 9.5 to 30 millisecond. Next, come to question number 19. What is false about denervation potential. Option A appears 2 to 5 weeks after nerve injury. Option B present in primary muscle disease. Option C includes fibrillation and fasciculation. Option D all of the above. Here the correct answer is option B. It is totally false. So in denervation potential, we found fibrillation, fasciculation. It generally appears in 2 to 3 weeks. Next, come to question number 20. For anatophoresis, positively charged ion kept at option A anode, option B cathode, option C any electrode, option D both electrode. Basically, uh, uh, in ionophoresis, the principle of repulsion is used. So we use anode for positively charged. Next, come to question number 21. Which electrodes are used for more accurate EMG? Option A surface electrode, option B needle electrode, option C both, option D none. Here correct answer is needle electrode. Next, come to question number 22. Medium frequency current numbness is known as option A amplitude inhibition, option B current modulation, option C uh, Widinsky inhibition, option D none of the above. Here the correct answer is Widinsky inhibition. Next, come to question number 23. Best therapeutic use of anatophoresis. Option A local anesthesia, option B antibiotics, option C anti-inflammatory drug, and option D hyperhidrosis. Anatophoresis is most established and effective for treating primarily hyperhidrosis. Next, come to question number 24. While applying direct current, the important parameter is option A current intensity, option B circuit resistance, option C current density, option D duration of application. Here the correct answer is current density. Current density is critical in direct current. The unit of current density is ampere per centimeter square. Why? Uh, because for safety protocol, uh, according to the guideline, limit is 0.521 ampere per centimeter square. That should be the current density according to the guideline. Above this, there is a risk for burn. Next, come to question number 25. Nociceptors are stimulated with a current intensity. Option A more than that stimulates sensory nerve. Option B more than that stimulates a motor nerve. Option C more than that cause tingling. Option D less than that requires to produce a twitch. Here the correct answer is option B more than that stimulates a motor nerve, because nociceptors actually C and A delta fiber have higher activation thresholds than motor or large sensory fibers. Next, come to question number 26. Iron used for edema reduction. Option A acetate, option B copper, option C hyaluronidase, and option D none of the above. Here The correct answer is hyaluronidase. Uh, Acetate is used for uh, anti-inflammatory. Uh, Copper is for antifungal. Next, come to question number 27. Principle of applying direct current. Option A, uniform current density. Option B, complete circuit. Option C, larger indifferent electrode. Option D, all of the above. Here the correct answer is all of the above. Uniform current density prevents localized skin burn and ensure safe iron movement. Uh, and complete circuit, basically current must flow from one electrode to another through tissue. And larger indifferent basically is 2.5 times. It should be 2.5 times. Next, come to question number 28, which is not true for anatophoresis. Option A, eliminates first pass metabolism. Option B, uncontrolled drug delivery. Option C, avoids pain of injection. Option D, decreases risk of infection. Here the correct answer is option B, uncontrolled drug delivery. Next, come to question number 29, which is true for fasciculation. Option A, spontaneous firing of the action potential of single muscle fiber. Option B, non volitional random contraction of group of muscle fibers. Option C, duration of 1 to 5 millisecond. Option D, frequency 1 to 50 Hz. Here the correct answer is non-volitional random contraction of group of muscle. Basically the duration is much more longer. It is near about 50 to 500 millisecond, and frequency is very variable, 0.1 to 10 Hz. Next, come to question number 30. Zinc anatophoresis is used for option A, neurogenic pain. Option B, ischemic ulcer. Option C, non-healing ulcer. Option D, anti-inflammatory effect. Here the correct answer is ischemic ulcer. Zinc anatophoresis is used for ischemic ulcer according to a case report of 1981. Next, come to question number 31. Mechanism of wound healing by electrical stimulation. Option A, skin battery. Option B, enhanced DNA synthesis. Option C, cell migration. Option D, all of the above. Here the correct answer is all of the above. Skin battery is bioelectrical potential. Normal skin has an endogenous electrical potential, and electrical stimulation enhances DNA synthesis and cell migration to cell cell migration is called uh, galvanotaxis. Sorry, galvanotaxis. Next, come to question number 32. Typical anatophoresis dose. Option A 20 milliampere per minute. Option B 40 milliampere per minute. Option C 60 milliampere per minute. Option D 80 milliampere per minute. Here the correct answer is 40 milliampere per minute. Next come to question number 33. In EMG activities, studies studied are in EMG we studies option A insertional and spontaneous, option B insertional and exertional, option C spontaneous and exertional, option D insertional, spontaneous and exertional. So here the correct answer is option D. Insertional activity is activity seen when the needle electrode is inserted into the muscle. Spontaneous activity is activity at rest, and exertional activity is activity during voluntary muscle contraction. Exertional is during voluntary activity. Spontaneous is uh, at rest, activity at rest, and insertional when needle electrode inserted. Electrode inserted. Next come to question number 34. Duration of anesthesia by anatophoresis. Option A 2 minutes, option B 5 minutes, option C within 15 minutes, option D 20 minutes. Here the correct answer is within 15 minutes. Next come to question number 35. Sequence of current for infected wound. Option A cathode wound and less than 1 milliampere current and change polarity. Option B anode wound less than 1 millisecond a milliampere current and change polarity. Here is also change polarity is present and change polarity is present in all options. So the correct answer is option A cathode wound less than 1 milliampere current is used and change of polarity after 2 to 3 days when the infection subsides and signs of granulation tissue appears. This evidence is from experiment by Walcott et al. In 1969. Next come to question number 36, which is not true for anatophoresis application. Option A low infection risk, option B enhance penetration, option C less systemic absorption, option D maximum skin irritation. Here the correct answer is very easy, maximum skin irritation. Next come to question number 37. Anatophoresis used for hyperhidrosis. Option A metallic silver, option B glycopyrronium bromide, option C xanthines nicotinamide, option D vinca alkaloid. Here the correct answer is glycopyrronium bromide. Metallic silver is antimicrobial and vinca alkaloid is anti cancer drug. Xanthan nicotinamide is generally not used. Next, come to question number 38. Source for anatophoresis is in hyperhidrosis. Option A, iodine. Option B, acetic acid. Option C, zinc or zinc. Uh, Option D, tap water. Here the correct answer is tap water. Zinc is basically used for wound healing. Acetic acid used for calcific tendinitis, and iodine is for iodine test. If anyone know what is iodine test, please pin in the comment that what is iodine test. Next, coming to question number 39. Number of moles released proportional to option A, amperes of charge. Option B, time. Option C, transport number. Option D, all of the above. Here the correct answer is all of the above. Amount of charge is equals to current in amperes in time and multiplication of time. Next, come to the last question for today. This question number 40. Factors affecting anatophoretic transport. Option A, ion concentration. Option B, vehicle pH. Option C, current strength. Option D, all of the above. Here the correct answer is all of the above. Ion concentration, higher the concentration, increases the increases the increases the ability of ions, uh, and vehicle pH determines degree of ionization. uh, Determines degree of ionization. Current strength, greater the current strength, increases the ion movement. Or thank you everyone for watching this video. This is the last video of top most important 100 electrotherapy question. Please do like, subscribe and comment. Thank you everyone.